Welcome to the Holistic Psychiatrist Podcast, a place for inspiration, insight, and information on holistic mental health. Join your host, Dr. Alice Lee, and discover critical information on safe, effective psychiatric medication withdrawal. Explore new ideas that enlighten and expand the mind with cutting-edge authors and experts, along with former patients as they share their miraculous healing journeys. It's time to build your well-being from the thought up. It's time for the Holistic Psychiatrist Podcast. Here's your host, Dr. Alice Lee.
Hello and welcome to the Holistic Psychiatrist Podcast, where building well-being from the thought up creates miraculous healing journeys. I'm your host, Dr. Alice Lee, the Holistic Psychiatrist, practicing in Stamford, Connecticut. Today we have joining us Emily, my co-host. She is here to give her perspective that's going to be coming from her experiences, both with conventional and holistic psychiatry. We're really looking forward to our discussion today. For more information about me, if you want to access free articles, podcasts, and contact information, please check out my website, holisticspsychiatrist.com. Thank you so much for listening. Today, we're going to be discussing conventional or holistic treatment failures. This is a topic that I've wanted to talk about for a long time. James Clear, the author of Atomic Habits, said, "Stories of failure resonate more than stories of success. Few people reach the top, but everyone has failed, including those who eventually succeed. If you're teaching people how to succeed in a given field or talking about your own success, start with how you failed." And I find James Clear to be just full of wisdom. If any of you want to follow some of his posts that come out once a week, I would highly recommend it. Today we're discussing and sharing our reflections and experiences on treatment failures and how both Emily and I dealt with them. Obviously, not every treatment results in successful outcomes, and those that do cannot be guaranteed to last forever. What can be gained from trying our best to help a patient and not being able to achieve the initial treatment goals? What can our attitude about these difficult experiences help us toward success in the future? Emily and I will share our experiences from the perspectives of both patients, and in my case, as a clinician, and in her case, working with many clinicians in our search for and our journey for healing. So welcome, Emily. Thank you for joining us.
Yeah, thank you. I think this is going to be a really good topic to discuss. I think we have some interesting questions and good information to share.
Yeah, wonderful. So I wanted to help us start with a realistic understanding of conventional psychiatry, treatment successes and failures. Perhaps you can share that part with the audience about some of the studies that have been out there about how these medications work and how successful they are.
Yeah, so I've got a lot of notes here. So pulling those up. Now, the different studies we want to talk about, this is actually from National Institute of Health, .gov. Looking at this, maybe let's start off with discussing the STAR D study, which major US study. I think you know a lot more about it than I do, if you can give us an idea of what that was. And then I'll read off some of the findings from that study that was pretty significant.
The STAR D study, which came out with its results in 2006, showed that treatment successes with antidepressants are quite modest. So to talk about a medication as an antidepressant, I think patients would be very surprised that over time, if you've had 4 different trials on these antidepressants, only 2.7% of the population will actually respond to the medication. Even under general research study outcomes, only a third actually result in long-term remission on the medication. And the rest, only a third is partial, and a third actually cannot respond to an antidepressant at all.
Yeah, and this study was specifically on SSRIs, correct, in terms of the antidepressants they use?
Yeah, I believe so.
Yeah. And it does say, so the initial remission rates for antidepressants achieves remission in approximately 33% of patients. So that's the overall success rate. And like you were saying, that they said 30 to 35%, only about 1 in 3 patients achieve full symptom clearance with the first SSRI. About 2/3 of patients see some improvement on the first or second drug tried. And then it did say in here, I think we were discussing this before we started recording, if the first SSRI fails, the chance of next treatment working drops significantly. So that's only after the very first treatment, your chances of success drop. Why do you think that is?
I think there's a lot of things that these medications actually do to the body. So once you get exposed to the medication, your body has been affected by the medication. So instead of underlying causes, now you have underlying causes, the medication effects, and then the medication withdrawal effects. So I think that adds up. For those people who don't have a clear idea of that, I'll try to summarize it succinctly, but you'll find it in my other podcasts on medication withdrawal issues. But SSRIs, they don't create serotonin. They actually just block the reuptake of serotonin. And the reuptake of serotonin is very important for the body in terms of the recycling of serotonin. So you don't have to keep making serotonin all the time. So if you block reuptake of serotonin, there's been some research studies that show a decrease or depletion of serotonin storage levels. And it happens fairly quickly after you start using the medication. My thoughts are that taking into consideration that exposure to SSRIs, you're really changing the person's next trial, another SSRI.
And that's a big reason why every single time your chances of remission go down. Every drug that you try, it even says here for those who achieve remission. And what was it that they considered remission? I think there's a difference in the way that they viewed success. There was true remission, and then there was
response,
which was, I think it said, what, 50%, about 50% of symptoms subside, having a positive response.
Right. So a response rate that they call success would be 50% reduction of symptoms, which for some people might be the difference between living and dying. But for actual remission, where you don't have any symptoms anymore, that is much less.
Yeah. And it does say for those, the relapse rates, for those who achieved remission, full remission, the relapse rate was high. Roughly 50% of patients who initially got better eventually saw their symptoms return within 1 year, even while staying on the medication.
And 1 year is a short amount of time. So if you use something like a medication, if you're looking at another 60 years of life, what is 1 year? And then all of a sudden you're left with some issues caused by the medication. And then I don't want to skip to the next one, but I think we could talk about the CATIE study, which is about the antipsychotics.
Yes. So we also have, moving away from SSRIs and into antipsychotics, there's the CATIE study, clinical antipsychotic trials of intervention effectiveness. And this looks like, it says over the past 20 years. This one's more recent, I believe, isn't it? Oh, 2006, research from 2006 to 20. So this one's even scarier for me looking at it, that it seems that it's even more difficult. Overall retention is 20%. And this is success rate for 18 months. Overall retention is around 26%. It says in the landmark CATIE study, 74% of patients discontinued their assigned antipsychotic within 18 months. Symptom remission, so again, this is speaking of actual remission, only 37 to 43%. Long-term follow-ups show that roughly 40% of patients achieve stable symptomatic remission. Functional recovery, around 15 to 25%, which is success in real life, holding a job, living independently, is significantly lower than clinical symptom reduction.
And what I recall from the CATIE study is that when you take an antipsychotic, that medication with all of its side effects cause, in general, you lose 10 to 20 years, I believe, of your life just to be on that medication.
20 years, yeah. One of the most significant success metrics over the last 20 years is life expectancy, the life gap. On average, people with schizophrenia live 15 to 20 years less than the general population.
And I think it's interesting that they would call it a success that you live 20 years less on a medication. They're saying antipsychotics keep you from accidents and killing yourself or harming someone else. So that's a success. But the patient suffers and they die 20 years earlier. So I think that would not fit under my definition of success.
Yeah, what it says here, you're right. People with schizophrenia live 15 to 20 years less than the general population, largely due to cardiovascular issues exacerbated by the antipsychotic weight gain. The paradox, despite these risks, patients who stay on their medication have significantly lower risk of death, all-cause mortality, compared to those who do not, primarily because the medication reduces the risk of suicide and accidental death. So I guess in their eyes, they're seeing the trade-off that you can lose 15 to 20 years off your life if we can help with the suicidal ideation, other risks like that. But I agree. That doesn't seem like a life I would want. I know certainly I was on an antipsychotic because I was one of those people who was the treatment resistant, got diagnosed with treatment resistant depression because 2 different treatments did not work for me. And I was put on an antipsychotic off label. And learning about this is really, really scary, knowing that there are other ways to treat these issues for a lot of people.
Right. And I think that a lot of blame is placed on the patients if they don't respond. It's like, oh, it's your illness. It's so difficult to treat, that kind of thing. I think that what it tells us in terms of that succinct summary of the CATIE study is that people with psychotic symptoms are caught between a rock and a hard place. You can either die earlier in your life by taking this medication and basically not have a 90% chance of not being able to function at the rate that most people in society would think is a bare minimum, right? Holding a job. Or you could end up being very vulnerable to delusions and psychotic episodes where your life is just not tenable. You can't live in that kind of delusional space. So that's how it's justified. But honestly, I thought that was the best treatment approach until a young man came to me with psychotic symptoms and he didn't want to be on medication. So I started him on some supplements. And within a week, he felt like 80% better. And in 2 weeks, he was already working at a grocery store and found a job and he felt great. There are treatments that do work for psychosis that to me seems almost miraculous compared to an antipsychotic that I'm familiar with and trained to use. So it's definitely worth researching or at least understanding more. But once a person gets on these antipsychotics, I think these are very heavy duty medications, and I've really struggled with how to help them get off of them once they get on them. And maybe we can switch gears and start talking about my experience as a holistic psychiatrist, trying to use holistic approaches to help people who have been on these antipsychotics or antidepressants for a long time, and just the whole holistic kind of success and failure rates that I've experienced.
So what does that look like for you as a holistic psychiatrist? Going off of that one example of the patient that you had as a holistic psychiatrist, what does treatment success look like for you?
I have a very high standard of treatment success, and unfortunately, it's my double-edged sword. Okay, so my idea of treatment success is when patients are going through their withdrawal and they don't have much in terms of withdrawal side effects, and they're able to stay well after the withdrawal process. And we can troubleshoot along the way so that if there are problems, we can quickly resolve them. So that's my idea. I don't expect a treatment withdrawal process or treatment even before a person get on medications. I don't expect it to be problem-free, but I do expect myself to be able to help that person learn the skills that they need and be able to remain well afterwards. So it's basically my idea of success is that when I am done working with them, that they can just not be patients anymore, which is, of course, insane for a lot of psychiatrists. They think that's not possible. It's like a miracle. But that's when I give myself an A.
Okay.
You did a good job.
Yeah.
Anything less than that, I give myself a B or C. And then occasionally I do give myself an F because someone didn't do well and they had to go back on their meds or whatever.
Yeah.
And that to me is usually after a monumental effort on my part to help them. And
Right.
it really makes me reflect on what I could have learned or done better. For example, early on, I realized that antipsychotic medications and antidepressant medication withdrawals are very different. And how did I know? Because of treatment failures. And so when very early on, this guy, Robert, who's on my podcast, came and he wanted to come off his antipsychotic, even though it was really small amount, he was on a small amount of antipsychotic, but he was having auditory hallucinations and he was having insomnia and stuff like that. And I told him that I didn't feel comfortable about how to help him in that situation. And how did I know that? Is because I tried. I tried to help some people off antipsychotics and had to put them back on because they just couldn't get off. There was something about antipsychotic medications that made it harder. He had asked, I believe, 8 other psychiatrists before he called me.
Wow.
They all refused to help him come off antipsychotic medication. He was in his 50s, I believe, when I started working with him, and he had been on an antipsychotic medication since his probably early 20s. So it was really an impossible situation. How could you help someone get better at that point? And especially at that time, I believe I had gotten maybe about 5 or 6 years of experience in holistic psychiatry by then. But he did use energy medicine very seriously. He didn't know anything about it, but he took it on. He, unbeknownst to me, he would repeat a lot of the EFT, emotional freedom techniques that we did in our session. He would do it every day in between sessions. I didn't ask him to do that because I didn't know that it would be helpful, but he would do that in between sessions. And he healed so well. I was like truly amazed. From then on, I decided to not say no to patients just because I think that they might be difficult in terms of a withdrawal. Because I realized with Robert that it really depended on the patient too. It's not just me alone working on it.
Yeah, and I was going to ask that. I think I mentioned to you, that's something that I've been looking at a lot lately. Of course, working on this documentary that I'm doing with having to do with psychiatric medication withdrawal. I'm in a lot of groups, support groups on Facebook, stuff like that. And one thing that is interesting to me, and the next time the filmmaker and I meet, we're going to discuss this and how to approach it. But it's the idea of how do I phrase this? What helps with success in terms of outlook of the patient, outlook of the doctor that you're working with, how you treat your successes versus your failures, holding on to hope, all of those sort of things, I think have an effect on the overall success rate.
Absolutely. And you are a success, right? And you've gone through all of those steps and stuff. So as a success, someone who had gone through so much, I know from our work together that you're very persistent and you work smart, meaning that you go out and you try to do some research and try to get data. And we've often relied on your research between sessions as you discuss certain things. And then we would build on top of what you know about what you've learned through your research. Nowadays, with the internet, we have access to so much information. And so patients do have that opportunity to look it up online and figure things out. But I am curious in terms of as you think about your life and all that you've gone through, all the times that you failed, but then got up and then had to keep going. Tell me about what it feels like ultimately to overcome failures and become a successful outcome.
It's hard to view myself like that. Sometimes it's just I started here and now I'm here, but when I do really reflect back, I can remember quite a bit because this was a journey that lasted several years, 3-4 years, several years before I even found you. But I know that for me, the desperation, honestly, the desperation is what led to a lot of the research. It was the only thing that I could hold on to. That was the only thing I could do. Either option, I was going to be laying in bed, unable to do anything, in quite a bit of emotional, psychological pain. That was just my life. So it felt like I could lay there in bed and just not do anything, or I could be proactive. And it wasn't even a decision. It felt very like I have to find answers. I have to find answers. So I just took to the internet, honestly, and just research. If I was talking to somebody who was going through this currently, I would tell them that I think it's imperative to find a doctor that you can work with that will listen to what you are bringing them and help you analyze it, because there's also a risk in relying on the internet, right? I think a lot of these groups, people are there to support each other, but I could read somebody's success story and think that's going to work great for me. Go off, try it. It can make me worse. So I think it's really important to find somebody to work with. I started realizing that was an option when I first started working with an integrative psychiatrist. This doctor really wanted to help me. I really believe that with my heart and soul. And he would take in the stuff that I was providing him, but I don't think that he really had the knowledge. And I continued to get worse, the way that he was cutting my medications, things like that, to help me come off that. He agreed I needed to be off the medication. But every time I hit a wall, I don't know, I guess I believed that there was still an answer out there. So I think he was the last psychiatrist I saw before I found you and started working with you. But yeah, I don't know. It's a very difficult thing to tell people just keep going. And I wish there was something else to give there, but I think that you don't look at failures as failures. You look at them as learning experiences.
I do feel that.
Yeah, recognizing the patterns. Okay, that didn't work. It's patterns. It's not necessarily failures, right? And I know that you've mentioned that as well, is seeing a lot of patterns with your patients when it comes to learning.
The beginning, when I first started, I was working with a company who had been selling their supplement. EM Power at the time was what it was called. Now it's called EM Power Plus. E as an elephant, M as in Mary, Power. They've been, I think, selling that supplement for 8 years before. And I thought that they would know a lot about medication withdrawal because that's what they did to help patients. And I was assigned someone to help me learn the ropes, so to speak, with using that supplement. But what I discovered very quickly in the beginning was that there were two groups. One is the group of patients who never been on medications, and they would get on the supplements and they would get better. And then later on, they needed to lower their supplements. And then they were gone and they were done. And then there was the other group, which were patients who were on medications. I would put them on the supplement. And again, they were just like the patient who had not been on medications. They would do really well. And then when we started lowering their medications, I noticed that they would, after a while, some of them would not do as well and some of them would do well. But the pattern was clear enough for me that I realized that medication withdrawal groups differed from the people who had not been exposed to medications. And that was really important for me because as a psychiatrist, the whole withdrawal process of medications has been swept under the rug at that time during my training anyways. I hope things have changed since then. I don't know that it has, but it was swept under the rug. So I had no idea about the consequences of lowering a medication. I felt like the medication somehow miraculously helped patients to get better, and that was a biological shift in their core essence. and that now that they're better, they don't need the medication as much. And the body will adapt, because I thought of it as a cast. Like once the arm has healed, you can take off the cast now. And now your arm is all better. That's the way we're made to believe medications helped patients. It's just that the cast needed a little bit longer for it to be there, like 5 years instead of 5 months or 2 months. So when I saw what I saw, I think one of the things that I think about treatment failures is that when you start with no understanding about something because you're in this field where people turn their backs on the patient's needs in that way because they're very intent on just using their medications to help psychiatric disorders, you have to see and then truly let the information sink in. You can't just keep blindfolding yourself and keep using the same paradigm. So I think that once I noticed that there were these groups, some were more successful than others, and being able to see those patterns, the treatment, quote, failures taught me to understand something very important. And that was medication withdrawal is a thing. And I have to be very careful. And you know what? That company who sold the supplements, they didn't quite get it, even though they've been using those supplements for 8 years at that time.
Oh, wow.
So, yeah, I don't think they really truly understood how difficult medication withdrawal was, or the intricacies. I can't blame them because none of them were doctors. They didn't have the medical training.
Yeah, it makes me wonder about my own journey and hearing about so many other people's journeys. As you were talking, I remembered, so going back to success rate too, I remembered early on working with the very first psychiatrist that I worked with, and those first couple medications, SSRIs that I was on, weren't working. And I wish I could remember who it was, but it was a female singer, celebrity, that I saw an interview with. And I remember her saying that it took her 15 years before she found a medication that worked. And I remember I was living in California at the time and calling my mom, and I was like, I can't do this for 15 years. I cannot do this for 15 years before I find an answer. And at this point in time, I knew nothing about side effects, withdrawal, anything like that. And it makes me wonder, because I have always been the type of person, give it enough time, truly enough time to see if something's going to work. I really believed some medications were working for a while before they weren't. But after several years of working with a psychiatrist and realizing I have periods where I get better, but then I'm worse than I ever was before, that was the time to start looking for something else. This is not the answer. But it does make me wonder. We talked about what success looks like for you as a holistic psychiatrist, but because you've had experience starting out as traditional psychiatrist and then moving into the holistic field, what's the difference there? What does it look like for a traditional psychiatrist, somebody who does treat somebody for 15 years before they get them on a medication? Is that pretty common in traditional psychiatry?
It's interesting because as a conventional psychiatrist, I was always trained in a setting, and also after I left, I worked in a setting where I integrated psychotherapy with medication management. And I had a very, very good success rate. And I don't think it had a lot to do with the medications per se. I think that I was able to help meet them heart to heart, like truly hear them, understand them. And I wasn't one of those psychiatrists that just went, every 20 minutes. There were certain things I said that patients would remember, or later on, they would write me a letter a decade later to thank me for my help in a setting that I'd completely forgotten about. So my success rate was quite good. However, I think intuitively, I didn't feel happy with what I was doing. And it wasn't because I lacked success in helping patients. I think all my patients really did quite well, but because I didn't want patients, once I was on medication, like on a Zoloft for those 5 years, I didn't want to be a patient. And I started to understand, why would anybody want to be a patient for the rest of their lives? So there was something about that whole way of treatment that sat wrong for me. And maybe it's just because I myself, growing up, really never took much in terms of medication. I seldom ever had an aspirin. I never drank, never had coffee, never smoked. I don't take chemical substances to patch up my problems. But as a doctor, that was what I was taught I should do. So I don't think it sat well for me. And especially once I became one of those individuals who had to go to the pharmacy every month and get a medication prescribed. I did not like that at
Right.
all. But I will say a lot of psychiatrists persist in a carousel of medications if a patient has failed, because if you only have a hammer, everything's a nail. And so patients will come in and they don't work, the medication has not worked for them. So they'll use a different medication and they won't give up because there's lots of medications to try. And they're sold by the drug reps who come to sell these medications that all of these medications work fabulously and have less side effects now. And so they can go from one new medication to another in hopes that it will work. And the sales reps for these drug companies, they will sell their product, and the doctor then will take that and sell it, their product, to the patient. So it's not like a doctor will say, if you take this medication, there's a 15% likelihood that you will actually be able to function. And the rest of the time, you might be sitting there in a rocking chair drooling all day. They're not going to sell it like that, right? They're going to say, oh, this is going to be great. It's going to be helpful for you. And they're going to just sweep all of the negative side effects and minimize it so that you will take the medication. And they will use their doctor authority to do that, their MD degree. So the patient will feel like, okay, the doctor prescribed it, so I'm going to take it. It's a long line from this pharmaceutical company who hires researchers that are paid by the pharmaceutical company to get the data to then give to the sales rep. These are data that may not be accurate because the researchers are paid by the drug company. And then you have the sales rep teaching the doctors, and then the doctors prescribe the medication. So I think it's very hard for doctors to get out of that whole integrated system and start to see clearly what is happening. Now, what was happening that got me into holistic psychiatry, and I've said it in other podcasts, I saw a lot of treatment failures from doctors that walked into my office with bipolar patients. So this is back in 2002, 2001. And they were all on a lot of different medications because bipolar illness were being treated with antidepressants, mood stabilizers, and antipsychotics. And all these patients had a lot of side effects. So they were coming in, and I would call them basically miserable because they couldn't get out of their between a rock and a hard place. They had a horrible disorder that cannot be lived with. And then they had all these horrible side effects with medications that they cannot live with. At that point, I was much more open to trying new things. And that was when I reached out for the company who pictured themselves or touted themselves or advertised themselves as being helpful for bipolar disorder. And that was what started me down the path of functional medicine.
So looking at these different treatments, we were just talking about trying different medication after medication. And of course, we know that from what we were talking about earlier, the studies, that every time you add a new medication, it's less likely to be effective. So when you're having quote unquote failure after failure, tying this back to earlier, what kind of responses to those failures do you think lead to more failures versus turning that around and starting to see success?
Do you want to know about conventional or holistic perspectives?
So it would be interesting to hear it from the holistic side, whether or not you've actually learned anything maybe from the conventional side as well that you've brought into the holistic practice.
So the question is, when people fail, what can lead to more failures from that failure versus more successes, right?
Right. Is there a way to turn those failures around into successes versus what causes the continuation of failure after failure? Yeah.
Yeah. I remember initially when I was in holistic medicine and I was fairly new in the practice. When I had someone who did not reach that level of success that I wanted for them, I wanted to quit. I didn't want to be a holistic psychiatrist anymore. It was like, this is too hard. This is too painful, because you know how I feel about people I work with, that they are like my family. I want them to succeed. It's like having someone die on you. How would anyone feel in those circumstances? The pain is just traumatic. So I would want to quit. Sometimes I would say, like during those periods, I tell my kids, I said, I can't do this. I want to quit. And if you quit, you're definitely going to fail. That stops your progress and learning right there. I remember every time I wanted to quit, which were quite a few, my kids would say something encouraging. Later on, they'll say, that's what you always say, but you just keep getting up and trying again. So just keep trying, or something encouraging like that. And I would have this big sigh, and I was like, okay, I'll keep trying. So I think that because I believed so much in a holistic approach, and I believed so much in the values that I held onto, that patients deserved to be free from this kind of bondage to their medications, I would get off and basically metaphorically brush off my knees and just keep going. And it was very hard. It was very hard because the pain isn't physical. The pain is emotional. It's hard to describe how painful it is. It's like a mother losing a child. It's just that painful for me. Then I would get up, I would look at that situation, and I would say, okay, should I not treat that disorder at all? Should I just leave antipsychotics alone and never withdraw another person from an antipsychotic again? And there's some comfort in that. Okay, I don't want to touch that medication again. That was hard. Now I know it's hard. I'm not going to do it. But then you have these patients like Robert, they come in, they say, please just give it a try. I don't care if it fails. Just let me have a chance. And I would say, I can do my best, but I don't know that we can succeed because antipsychotics are so difficult. And with the patient, then being a courageous partner who is able to march into the unknown, so to speak, with me, I would use my energy testing method, and I would dig deeper into what's going on and learn more along with the patient. And I would use every tool that I had. So with Robert, I was already learning about energy medicine. I knew about energy breaths by then. I knew a lot about supplements by then. My repertoire of supplements had grown in leaps and bounds. And I was like, I'm going to do my best. I'm going to learn from my previous failures. I'm going to learn even more with this patient and see if I can help that person. So it's always this openness to learning, this mutual goal. I would just say that the goal is nothing less than the empathy that you have and seeing yourself in that patient. I understood what it felt like to be a patient. I understood how much you wanted to be free. And that empathy, I also understood what it felt like to be labeled like that. And so the empathy and seeing myself in that patient, when I would help him in that particular example, it was like I was helping myself in some way. And when he did so well, I was like, whoa, I didn't expect that. I was truly happy. But then they leave, and then you have another patient who comes in, and metaphorically, it's like they come into my garage and they don't have a steering wheel, an engine, a battery. The doors are falling off.
Yeah.
And I fix my car. So you move on to the next patient. And with each patient, you have to have faith and hope, just like you do. When you try to get better, you have to have faith and hope that the next attempt is going to work better than the attempt before.
Yeah.
Even astronauts that go to the moon, there's a lot of rockets, a lot of attempts before some success finally reaches that ultimate pinnacle.
Yeah. I think what you said just a few minutes ago was that the ultimate failure is giving up. I think that's what it was a big part for me too, that you're not really failing until you fully give up and you're not trying anymore. And I think that somewhere in my mind, as I was going through what I went through, I knew that, maybe subconsciously, but I think that's very true for probably patients and clinicians, that like you said, it's always about just learning as much as you can and keep going.
I don't remember how long ago it was, but you asked me for the documentary something about holistic psychiatrists, and I told you that a holistic psychiatrist has to be one of the most optimistic of all.
Yeah.
I don't know what I wrote, but you have to have this eternal optimism that what you're doing is worthy of the effort and that the person is worthy of that effort. When you're just doing medications, it doesn't take as much effort. But as a holistic psychiatrist, the effort is indescribably much more difficult just using a medication and being in a safe space, because isn't that medication called an antidepressant? And isn't that medication called an antipsychotic? And therefore, aren't they supposed to be used when a patient comes in with those symptoms? So you are safe if you use something with that label on someone who comes in with those descriptions. And what if the patient dies? It's not your fault because you were just doing what you were told.
Wow.
But it is life or death, isn't it, Emily?
It is. Yeah. In so many cases. Absolutely. As we're wrapping up this conversation, I think that we really hit the keep moving forward, keep trying, keep researching. But are there any other ideas or advice from your experiences that you think would help patients or clinicians who have failed to reach their kind of treatment goals?
I think what I've learned is the most important to success is to learn from your failures
Yeah.
and to keep trying to learn. For most of my patients, they get into a point of understanding about me that I am always learning.
I feel like every appointment we had, it was, oh, I learned something new. And then we would implement it, whether it was energy work or supplements.
Yeah, it's very important to keep learning. Now, I don't consider myself to have any talent or any interest in biological data. I'm not interested in even memorization or any of those things that are less than what I would consider creative endeavors. But what motivates me to be studious and to learn is that I want to know things that can be useful. I want to know things that can function in a way to lead my patients to a happy ending. And it all boils down to, is this patient going to get better if I learn more about this or that? And if I don't feel that the information is helpful, I may not waste my time learning that. But if I know that what I'm learning, for example, we spend quite a bit of time learning about endometriosis, right? And it's not something that as a psychiatrist, you typically want to spend a lot of time learning about, but it was something that was useful to you. And so we did some study of that. You showed me what you knew about it. And remember, one of our energy sessions on endometriosis led to some big shifts.
Yeah, it happened. There were two significant times. One several years ago when I was still withdrawing off medication, I think, that shifted. And then much later, another one that reduced pain significantly.
Yeah, so you never know what can happen. So what do we know? We know that you have to keep learning, hope, faith, keep studying, and don't keep thinking that one path is the only path.
Absolutely.
So I hope that our discussion has helped people who are listening up to this point. Emily, do you want to leave some advice for them as well? Someone who has gone through so much, come out the other end.
Yeah, I think it's interesting that we came in with this discussion from two different perspectives, and we're really landing, whether you're a clinician or a patient, we're really landing on kind of the same conclusions, because I agree with everything you just said. I think as a patient too, it's your responsibility to also learn as much as you can about what's going on, whatever that means for you and your situation. But like I mentioned earlier, I think it is so important to not give up on finding somebody to work with, a doctor, a clinician, psychiatrist, that will listen to you, take in what you've learned, and help you figure it out. I think that is, when I read about success stories, mine is obviously the success story I have is in thanks to working with you. But when I read about other success stories, it is often because they have found someone who will listen and work with them as well.
Very good. Thank you for that advice. For those people who can't readily afford a holistic psychiatrist, one of my suggestions to them has always been, you can combine a couple of clinicians that are not MDs. You can use a naturopath, and you can also hire someone who does a lot of energy medicine and combine them together into a team to have this holistic perspective of both functional medicine and energy medicine. And hopefully that will move the person in the right direction.
Absolutely.
That can be a lot less expensive than someone who is integrating everything together, especially someone with an MD credentials. So I hope that would be helpful. So just to give people a brief summary of our podcast, I think one of the things that I wanted to share in summary about treatment failures is that even with treatment that is supposed to be the best right now conventionally, they have a lot of failures. So it's good to go into conventional psychiatry having that data and understanding that all of these bright promises that they're giving you isn't necessarily unbiased in terms of their perspective. When you go to a holistic route, don't expect something to work right away. There's still a process of healing that needs to happen during that process. So I hope that people will be able to find success, even if it doesn't happen right away, because not everything is a failure if it doesn't successfully treat the symptoms within a month or 2 months. And for those people who have stuck with this podcast up until the end, I just wanted to thank you for listening. I hope you've gained hope and faith and some uplifting, encouraging thoughts from listening to our podcast. Please subscribe if you haven't. Give it a positive rating if you haven't had a chance to rate this podcast. And please come and visit my website, holisticspsychiatrist.com, where you'll find a ton of free articles and helpful podcasts that can be very encouraging as well. And if you wish to integrate high-quality nutritional supplements from reputable sources, please go to my Holistic Psychiatrist website and sign up for FullScript. A small commission comes from that sign up that supports me in my practice. And I want to thank you in advance for doing that, for helping me support my practice and my podcasts. And I look forward to sharing more insights with you through podcasts and articles, and hope you'll thrive as you build your life from the thought up. Thank you for joining us today.
The content provided by this podcast is for informational purposes only and has not been approved by the US FDA. This podcast is not intended to provide personal medical advice, which should be obtained from a medical professional.